I think the study of consciousness in cardiac arrest research is one of the most important questions, and it, I think really touches upon questions of what does it mean to be human, what does it mean to be alive, how do we formulate an identity? I think that we know very little about what is going on for this person and this person's awareness during the time of a cardiac arrest. People have described things afterward and kind of recalled things from the room when they were in cardiac arrest, or kind of described seeing their lives flash before their eyes, or kind of other very vivid experiences. And, what is happening there, we just don't know. And I think it is a very important question to explore in the care of these patients.
While seemingly not conscious from the perspective of others who are looking at this person, and others who might even be attempting to revive the individual medically, from the perspective of the person who's going through death, and who's entered into this state of coma, paradoxically, there seems to be a continuation of lucid thought processes and consciousness without physical pain or distress. What if during this period of seeming unconsciousness from the outside world's perspective, a fascinating, lucid, transcendent, meaningful, and purposeful experience emerges that follows a very specific narrative?
There are accounts of what we now call near-death experiences from ancient Greece and Rome. And in fact, every culture in which people have looked for histories of near-death experiences, they found accounts of these. It was Raymond Moody, actually a medical student at the time in 1975, who used the term near-death experience for the first time in English. And he had, in medical school, asked his patients who had been close to death what they remembered of the experience. He found about 150 of these cases in his patients during the course of his medical school. And in 1975, he wrote a book called Life After Life, in which he used the term near-death experience and the acronym NDE. And that was the name that stuck, for better or worse.
Based on the scientific and medical advancements of recent years, we have evidence to believe that many of the people who've described their experiences had gone beyond the gray zone of death and returned to tell their stories. So this means that the term near-death experience is in fact a misnomer, which is why recent studies have re-established a new terminology for referring to these phenomena. We now call them recalled experiences of death, or REDS for short.
It was my first day as a doctor. I was, I think, justifiably terrified. I had a second-year resident who was supervising me, who promised me that he would cover my back and be present throughout the entire 36-hour period. So I went up, I introduced myself to this patient, and the patient's eyes rolled up in the back of his head, and he fell back onto the bed lifeless. So I dove on his chest, I started CPR, and initiated resuscitation practice. Eventually his wife showed up, and the nurse came in and said, "Will you please talk with the wife? I'll shock the patient if he rearrests." So I went out and talked to her and was not very optimistic in my discussion with her. About 11:30, his lunch showed up. Well, I hadn't had breakfast and I hadn't had lunch, so I went ahead and ate his lunch. Finally, about 1:30 in the afternoon, he finally stabilized, had a return of pulse, and that pulse was stable. The patient had a very rocky course, was in the hospital about a month after this. And on the last day, I walked into his room. He said, "Tom, please sit down, shut the door." And I did that, and I said, "Well, what can I do for you?" And he said, "I had an experience during this arrest that has been bothering me for a month, and I need your help." He then explained that he had left his body, and he explained everything that I had done, that I was doing CPR, the shocks. He followed me down the hallway to my discussion with his wife, and he said, "You know, I thought you were pretty pessimistic about my options, and you should have been more optimistic, Dr. Aufderheide." He said, and if that wasn't bad enough, You ate my lunch. So that all was a insight for me, but then he really said something that got my attention. And he said, and I thought it was unusual that here I was dying in front of you, and you were feeling sorry for yourself because your second-year resident had left you alone and wasn't supervising you. Now, I had never verbalized that embarrassing thought to anyone. But he told me what I thought. And that really got my attention.